Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. And don't forget to subscribe my channel and also please give your valuable comments. Friends, as we are discussing in the last two classes regarding ADHD, attention deficit hyperreactive disorders. In the first class, we have seen the attention seeking behavior and importance of attention in the psychological development. And in the second classes, we have seen the basics of ADHD and how it incidence wise it varies and what are the different types and all. And this class we will discuss the very important part, that is a differential diagnosis of ADHD. In the clinical setting, it is very important to differentiate the ADHD from other similar looking disorders, mimicking disorders. Okay, so we should not do any, because ADHD, diagnosing ADHD is a big statement actually. So you should be little responsible and careful before conveying this to the parents, because parents will get upset by this diagnosis, autism, ADHD. These are the things which will going to upset the parents very much. So need to be very careful, and also we have to ensure our diagnosis. Therefore, the important differential diagnosis now we have to consider. One of the very important differential diagnosis for ADHD is oppositional defiant disorder. Oppositional defiant disorders. This is also called as ODD. So what is this? Child is showing some opposition to each and every words of the parents or relatives, etc. So we will see in detail. Uh, Oppositional defiant disorders or ODD is quite common during the 8th year of the life or 8th year onwards. So one thing is very clear: the oppositional defiant disorders will not be seen in the early part. A preschooler is coming, or in the early part, 6 or 7 years he is coming, the chance of oppositional defiant disorder is less. But in the later part, if the child is coming to you, your OPD, then in the ADHD, this is one of the very important differential diagnosis. Now, actually, what is this? There will be argument with the adults. The child will start argument with the parents or adults for each and every word. Okay, whatever you're telling, child is going on argumenting. He's not vidheya to you. Ayurveda says videyatva. Okay, so what actually parents expect is child should be faithful and child should be obedient to you, obedient to them. But here, unlikely, the child is starting argument for each and everything. Okay, it looks very abnormal sometimes. And child also lose the temper very fastly. He also lose the temper, so he can throw away some of the things, so he can go away, he can lock himself in the room, etc., and he will be very much angry. Okay, and with this he deliberately annoy the others, he cause the pain to others, he may beat somebody, or he may beat himself and cause self damage. Okay, so deliberately he is annoying the others and also himself. He blame others for the mistakes and the problems of his own. Usually he will do some mistakes and he will make responsible others to that particular mistake. Okay, the innocent kids who are present in the home, they will be get targeted by him, they will be targeted by him. So he know that he is doing the mistake, but he will do that. Okay, he blame others for his mistakes or problems. In this age is 8 year is common, that is in the school going period. Okay, school going, he may be in the second standard or third standard. So in this period he is doing all these activities, and do not violate the basic rights of the others and social norms like conduct disorders. Now this is very important. Although he is doing all these things, in case of oppositional defiant disorder, he is showing some opposition, he is showing some resistance, he want to establish his own thoughts, and he want to prove that he is right. Okay, and all these things. But one of the basic things, although he is doing all these things, he is beating others, he is beating himself, he is arguing, and he is creating an unhealthy environment, and he is proving that he is right, but still he will not violate any of the basic rights of the others and social norms like conduct disorders. Okay, so although he is doing all the things, he is not doing the basic, violate the basic rights. That means he is not removing the clothes of the others. Okay, or he himself will not remove the clothes and run here and there. Okay, he knows that social rights and social custom, he know that, and he used to follow that, although he's doing all these things. But rather, in case of conduct disorders, if you see, Along with all these things, he also forget the basic rules of the society. Okay, so in conduct disorder, he may run nakedly in the road sometime. That we will see later. But this child is not doing all such. He respect the basic rights of the other child. He is disturbing them. He is annoying him. He is also beating him. But he will not all those things. Okay, and he will not touch the private parts of the other kids, etc. So um, uh, such basic rights of the child is preserved here. Okay, that value system is preserved. So that's the basic thing, how to differentiate. That's oppositional defiant disorders. This is also called as ODD, and sometimes this create a confusion in the diagnosis with the ADHD. By looking at these behaviors, you also think that it may be a ADHD-like problem, but actually it is not ADHD, looking like ADHD, but it is a oppositional defiant disorder. He don't have any problem with the speech. He don't have any problem with the understanding. He don't have any problem with the attention also. He knows everything, but still he's showing opposition to resistance to each and everything. If anything happens to him, so he is not able to tolerate it. He'll always prove that he's always right. He tried to prove that. So he may tell lie in the process. Okay, he may disturb others in the process. So he may theft sometime during this process. He may show the runaway behavior. This type of behaviors will be seen. This is considered as oppositional defiant disorders. One of the main differential diagnosis for ADHD. Another important differential diagnosis is a conduct disorder. Conduct disorder. Now, this is very serious disorder, of course. Here the problem is there with the conduct, shilha or charitra of the child. That is get affected. Okay. So there will be aggression against the people or animals. So child is showing aggression towards the people or animals, and child has lost all the social value system. Okay, so while moving in the society, there should be some code of conduct which we have to follow, isn't it? For example, we cannot go nakedly in the society. Okay, we can do not do some nuisance in the society, in the road, or if you're traveling in the bus, you cannot do some of the nuisance. Now, a child with the conduct disorders will have all these problems. Okay, so this is one of the very serious problem actually, and there will be aggression in the child against the people and animals. So he can start showing the aggressive behavior against the people and also against animals also. Okay, and he may also cause the destruction of the property. Now this is very important. When he got the aggression, he may throw something to the TV and TV is now broken. So he is causing destruction of the property also, and he don't know that I should not do. He don't know that because he lost that particular power. So very few friends precursor to ASD, and such a people, a child with the conduct disorder, he usually have very few friends. Nobody comes to him, and he has got a big tendency, great tendency to going towards antisocial behavior. Antisocial behavior is very important. Now, fire setting, thrifting, then beating others, destroying others' property, or throwing away others' pens, etc., other property, etc., tearing the books, such type of antisocial activities, okay, or beating others and destruction of the property. So these are commonly seen. Fire setting, and runaway behavior. So so this is quite common. Now, again, here the family background should be understood very well. Sometimes you get some clues from the family itself, and they have such incidents in their family also. One thing. Second is family background, how the familial environment, that is also very important. Okay, environment. Sometimes familiar environment will be like that. If some of the elders are also doing such type of cruel things or antisocial activities, so child is observing, and maybe child is also getting into that particular habit. Okay, so even they force others to now. One more important problem in the conduct disorder is about the sexual problem, and child is doing some of the abnormal sexual activities, sexual movements, or touching the genitals. This is not seen in oppositional deficient disorder. Therefore, I specified. Okay, now here he's touching the private parts of the himself and others, and he's doing some illegal type of sexual activities, etc. So this is because of loss of conduct, charitra. Okay, so shilatva, so that has been lost. So sexual activities. Then fire setting is common, runaway behavior I told. So this type of disorders, they are called as conduct disorders. Now at times this also confused with the ADHD. Okay, but this has to be understood. The child is having good attention here, everything is fine, speech is okay, and everything is okay. But in spite of that, he is doing. But in case of attention deficit disorders, we have got problem with the attention, and there will be impulsivity there. There will be hyperreactivity there. So here, such activities are not so often. In ADHD child, he is always having this problem. But a child with the conduct disorders, occasionally he will have this behavior. At times he may be looking normal or keeping quiet, silent, but suddenly he start with this. So this is how we have to differentiate a conduct disorder from ADHD. Now we have a case discussion and then we'll try to understand this problem. And Ramesh, a school-going boy, and trouble really started when he started going to the school. This is a case discussion. All of you be attentive, and because attention is very important in ADHD, so be attentive and look at this case. So Ramesh is a school going boy, and trouble really started to him when he started going to the school. He does not seem capable of attending his work or following the instructions given by the teachers. So he would rather talk to the neighborhood and also wander around the room without teacher's permission. So this is what actually the setup scene. When he actually is seated and doing the work, his body seems to be in motion. Even if he is sitting, he's continuously doing some of the motions. The hand is moving, leg is moving, trunk is moving, like that. So he's tapping his pencil frequently. See? So this is a typical case of ADHD, how we clinically we can see. He's tapping his pencil. Teacher says always he's tapping the pen and pencil and fidgeting and starting out the staring out of the window and also sometimes daydreaming. He's in his own world. And he hate the kindergartens and has only few long-term friends. He don't have any friends. This is the teacher's wordings. Now, school rules and challenges are looking like impossible challenges for him. He's not able to follow the school rules, and so in the school we have a rule that yes, till the bell rings you have to sit there. Now this fellow is not able to do that. Okay, it's quite impossible to follow the school rules and challenges and all. So he has academically fallen behind and had a real problem in mastering the new concepts. Academically, slowly he is falling down now, and he is actually having problem in understanding the newer concepts. Older concept he can by heart it, to some extent he can repeat it. He no longer follows the teacher's directions and also started talking back. Nowadays, he's also giving some back answers. Now again, this particular word nowadays is not following the teacher's direction and is also giving a back answer. Now the first differential diagnosis, that is oppositional defiant disorders, so that has to be considered here. Oppositional defiant disorders, that has to be considered. Okay, let us see what is the main differential diagnosis here. So when you get the patient of ADHD in OPD, so we have to go for complete history and physical examination, and we have to look for neurologic problems and also genetic problems. So there are some similar disorders which looks like ADHD, isn't it? Now, two important we have seen: conduct disorders and oppositional defiant disorders. Apart from that, there are some other behavioral disorders also there which looks like ADHD. Look for anxiety disorders. Many times, even the anxiety disorders in the children may also looks like ADHD. Depression disorders, then sleep disturbances like sleep apnea, then substance abuse, then oppositional deficient disorders, misbehaving. A similar common word for oppositional defiant disorder is misbehavior, too much of misbehavior. Then conduct disorders, then learning disorders. See, these are all the differential diagnoses. Previously, we have discussed two important things. One is oppositional deficient disorders and conduct disorders. Now we have got other list also. Even the anxiety disorders, depression disorders, sleep disturbances or sleep apnea disorders, substance abuse, and learning problems or disorders may also at times looks like ADHD. So we have to be careful before doing any diagnosis. Now, This particular case here, that what we have discussed, Ramesh, a schoolboy. One is school-going boy. So age is school-going age. It is not preschool age or adolescence age, school-going age. So here the problem will be always like this. The learning problems are more and difficult in making the friends that we have seen in the last class. Okay, age-wise, how we have to find the different symptoms of ADHD. So he has got different difficulty in making the friends, not able to concentrate, not able to sit, not able to follow the rules and regulation, and impulsive. So all such things will be seen here, okay, in this case. And impulsivity, hyperreactivity, because even the history says that even he is sitting in the class, his body portions are moving. That's he is a hyperactive and impulsive. Okay. And only thing that confuses us is nowadays he started giving back answer to the teacher. So this may be a misbehavior or oppositional defiant disorder, but does not look like that. So this is a clear-cut case of ADHD. Okay, this is the clear-cut case of ADHD, and we have seen some other differential diagnosis also. So thus we have completed some of the important differential diagnosis of ADHD. Okay, differential diagnosis of ADHD. Now there are so many other differential diagnoses also there for the ADHD. For example, a child with the cognitive problems, for example, in case of Fragile X syndrome, and a child with a mental retardation may also show sometime a symptom similar to the ADHD. Okay, some of the environmental factors and psychological stress that may be also showing the similar problems. And medical condition, for example, sensory impairment. If the child is not having a psychological problem, but he has got some medical problem, like he has got some psychological, sensory impairment, he's not able to see properly, he's not able to hear properly, then also this type of behavior can be seen sometimes. Lead poisoning, plumbism. Lead poisoning is quite commonly present with such problems. Asthma, then thyroid problems, especially hyperthyroidism, because in hyperthyroidism child is very active, overactive. Okay, so that may confuse. Then sleep disorders we have discussed, petit mal seizures, daydreaming and all, which is explained in this particular case. So in the petit mal seizure also the child is totally staring at somebody for a few moments. Okay, then he will be okay. So even the petit mal disorder seizure, petit mal seizures may also confuse. Iron deficiency disorders, iron deficiency anemia like disorders, that particular anemia leads to the loss of concentration. Okay, loss of concentration, loss of attention, loss of activities, etc., because of anemia. So that may also sometimes confuse. Then obstructive sleep apnea, we have seen seizure disorders, of course, inappropriate school placement, sometimes psychological. Then unrealistic expectation from the parents, so that is also sometimes possible. Then anxiety problems we have seen, mood disorders, and intellectual disability and specific learning problem, this we have seen. So apart from the previous list, this is also a very important list that we have to consider when you're going for a differential diagnosis of the ADHD. In total, before giving the label as ADHD, be careful. There are so many physiological things which is existing. There are so many medical aspects which may lead to a symptom like ADHD. For example, hyperthyroidism. Okay, hyperthyroidism. Child is overactive, and you cannot label him as ADHD. Okay, seizure disorders. It's a separate set of disorders, not the ADHD. Okay, it's an abnormal electrical impulse which is doing discharge, which is doing this particular action. Sometimes the parental expectations are too much. If the child is 2 year old and parents are expecting some very much, and then they are overtraining him, and that may also lead to such type of problems. So some of the syndromes may also lead to this type of problems. So in total, diagnosis of ADHD be done very, very carefully, and we should not hurry for it, and we should not give the diagnosis to the parents too early, and we have to be very careful and before giving any diagnosis, because this such a type of diagnosis, when you convey to the parents, usually they are get upset, and that creates the stress. So be careful while doing the differential diagnosis, and take your own time and do the diagnosis. So thank you very much for patience listening. Don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much. We will meet